Well, it's good to know your doctor, get wellness checkups, and just check in at least once a year. Joining me today to tell us more about that, to my immediate left, he is nurse practitioner with Mercy Health St. Rita's, Casey Counts, and then to his left, Dr. Christopher Clement, and he is primary care physician at St. Rita's. So thank you very much for coming today, both of you.
Thank you for having us.
Okay, so why is it important for men and women to have a primary care doctor and, you know, to go and get annual checkups?
Well, it's good to go and get a checkup, because then you can have an opportunity for the provider to do an assessment on you and maybe give you some information on things you didn't even know that was going on with you. And a lot of times when you establish care with a primary care provider, then it's a lot easier for us to see you more frequently if you need to be seen.
Now, when you go to the doctor, are there certain things that you guys are checking all the time, and are just certain testings maybe that you should always get?
Yeah, there's national guidelines set kind of the standards for testing and lab work that we do, of which they're very specifically and tailored to the individual patient as much as possible. These are with the aim of trying to screen for and monitor if there's any things that we're missing or need to address that we don't know about. So there's some routine lab work, such as blood work that checks your liver function, your kidney function, thyroid function, and some blood cells. These are pretty routinely done at least once a year, but individual practice differs. With regards to screening, age and sex, as well as certain risk factors and lifestyles, certainly put you at risk for certain things, and we screen for those as well. For example, colon cancer screening starting at age 45 is one of those, or earlier if you have a family history, such as the risk factors there. With respect to gender, for example, women have screenings for cervical cancer screenings with pap smears, as well as breast cancer screenings. Also, for example, if you're smokers, smokers have lung cancer screenings that we do, and as well as for males, for example, as part of gender as well. Age 65 and up, we start looking for triple aortic aneurysms. So, in short, these screenings are tailored and guided by evidence-based medicine, and very tailored to the individual patient. We don't try and test willy-nilly, but there's a point to all these tests.
Sure, yeah. Well, and it can catch important things too. And so, you know, you focus on physical health too, but also we know mental health is so important. Do you kind of do both too while you're there for preventive care?
Yeah, we do. Normally, annually, we're going to assess you for depression and anxiety. Going to ask you a couple questions just to kind of gauge how those things are. If those screen positive, then we're going to take a deeper dive and try to figure out, you know, what's going on specifically and see what we can do to help you. So even if those don't screen positive, we're going to, you know, ask you about your wellness and just try to have a conversation with you, because sometimes you don't even realize how bad things are. And so we'll take the opportunity to kind of figure out where you are and what kind of resources we can provide to you to help you with your mental health.
Right, yeah. And early detection, I mean, that is really key for so many of the things that you mentioned, but also I know, like, it seems like diabetes is up, people have high blood pressure. Some of those things people might not even realize until they get to your office, right?
Certainly, yes. Early detection and monitoring is kind of the bread and butter of primary care. We want to try and address the disease before you get it, but once you get it, also try and take first-line steps to try and treat as soon as possible. A common case is, for example, cancer detection for monitoring and screening that we do, as aforementioned. Early detection obviously tends to lead to better results because we can catch it earlier before it spreads and metastasizes, and more treatment modalities are available early on. So that's one, for example, for cancers. Another one would be for, as you mentioned, diabetes and high blood pressure. Those are chronic conditions that we are concerned about the long-term effects. So it's not the next month that we're worried about, it's the 10 years down the road, which increases your risk for heart attack and stroke. So those are also things that we try and mitigate and control to reduce that risk for heart attack and stroke.
Right. All right. So if you're one of those people sitting at home and I haven't been to the doctor in ages, take that first step, right? It is possible. Get an appointment made.
Yeah, absolutely. We're just a phone call away. If you don't want to call the office, you can make an appointment online. We're available 5 days a week. And you just have to stop in. It will be a quick appointment, and we can do an assessment and try to figure out where you're at.
All right, get yourself a healthy condition and know about it. Well, thank you both for coming today. Good stuff.
Thank you for having us.
Thank you.
All right, don't go away. Noon Edition continues in a moment.